and not stand for re-election at this year's annual shareholder meeting. The announcement is consistent with our new 12-year director tenure policy that aims to facilitate board refreshment while also enhancing diversity. Both Phyllis and Bob have served on the Revance board for over 15 years and have made invaluable contributions to the organization all along the way. In particular, they played pivotal roles in guiding Revance through our clinical development, financings, IPO, and more recently, our commercial debut. So on behalf of the entire organization, I want to express our sincere gratitude to Phyllis and Bob for their service and contributions to Revance. With that, I will now open the call up for questions. Operator?
Thank you, sir. Ladies and gentlemen, if you have a question at this time, please press the star, then the number 1 key on your touch-tone telephone. If your question has been answered or wish to remove yourself from the queue, please press the pound key. Your first question is from Ken Cacciatore from Cowen and Company. Your line is open.
Hey guys, congratulations on all the continued progress. So just a couple questions. The first, understanding you don't want to nuance too much on revenue guidance, but can you help us with the fillers concerning, is there any buy-in? I know there was nice commentary about good reorder pattern, but as we think about first half of the year, should we be thinking of a little bit of a step down before you reload and kind of regrow off of the Q4 level? Just any nuance if you can help us there so we don't get too far over our skis. And then wondering on the DAXI kind of regulatory communications, obviously we're waiting for the inspection, but I don't know, Mark, if you'd be willing to talk about any kind of labeling discussions or give us any nuance about the communications at that level as we wait for that to be finalized. And then lastly, just wanted to ask strategically, obviously wonderful progress on the therapeutic side of the fence, and we're going to continue to invest behind them. Can you talk about the balance between maybe looking to partner those assets versus you wanting to keep them whole? Obviously, you have a kind of wonderful both aesthetic side and the therapeutic side, but how do you balance these two? Are we going to keep investing, try to keep them whole, or are you thinking about maybe starting to talk about or think about licensing? Thanks so much.
Yeah, Ken, this is Mark. So let me kind of walk through the different questions. So first one on revenue cadence on the filler line. You know, as you're aware, we're 1 quarter into our launch, and I think that's part of the reason we've said we're not in a position to give guidance yet, just because we're only 1 quarter in. And obviously we've got seasonality. Q4 historically is a big quarter, partly because of, consumer demand and partly because of year-end programs that are designed by, some of the large companies to incentivize purchases. And then you've got, obviously, COVID that's going on. And on top of that, you had the 1 week out of the quarter where, some of the country was shut down due to, cold temperatures. I paint all of that because we just think we're early in this process to really fully understand launch trajectory and the patterns. But we're obviously really encouraged with how it's going. And so, on the positive side, we're launching a brand new product in a very targeted fashion. I think it's just a little premature, and I understand that you're trying to figure out how to, build your models and what to put there. But I think we're still a little bit away from being able to give, numbers with a little bit more confidence there. So stay tuned on that. But we are encouraged by what we're seeing in the marketplace. I will say one other thing that we found is that procedure volumes are encouraging. We're definitely seeing a V-shaped recovery and good volume. Access to accounts can be a little bit more challenging. In more traditional times, you can see reps sort of swinging by accounts unannounced, checking in. That engagement has become a little bit more regulated as accounts are sort of focused internally and they have some things that they're working through in terms of, staff and, access to schools and those sides of things. And so I think we're just early. Again, we're really encouraged by what we're seeing in the launch trajectory and the validation of the strategy. So as we have kind of more data points that we can rely on, we'll certainly share those. On the DAXI regulatory side, as you're aware, in Q4, we got out in front of our PDUFA date of November 25th and indicated that an inspection had not taken place. And the reason we did that is we broke with tradition of commenting on where we are in the regulatory process because given the unique environment with COVID-19 and the inability for the FDA to do inspections, we knew that with this date coming up, we weren't going to hit it. We then moved into sort of the deferral category where there's no statutory time frame, and we think, frankly, it's prudent for us to go back to typical company policy and not comment on where we are there. You asked the question about where are we at other aspects of the overall review. In November, we did indicate that the FDA didn't indicate that there's anything outstanding other than the actual facility inspection. So, we are excited to get the product on the market as soon as possible, but we're going to revert back to prior company policy and not comment on the specifics there. And then lastly, on the therapeutic side of it, like you, we're obviously very encouraged by what we continue to see out of our therapeutics pipeline. I think that with each additional clinical trial program that we run, we continue to see a very consistent duration of effect of our neuromodulator and very encouraging kind of safety and efficacy profile. So I think that what we've messaged earlier is that we wanted to get through what was a pretty heavy phase of clinical data readouts. Certainly now that we've got the phase 2 adult upper limb spasticity data in hand, we're going to circle back up and spend more time addressing kind of the question you raised. Do we partner this out? How do we think about this overall? We've obviously got capital allocation and other decisions that we need to work our way through. So more to come there, but certainly with the data that we've generated, we think it opens up sort of a lot of optionality for us as we look ahead and try and figure out the best way to drive shareholder value.
Great. Thanks so much.
Thanks.
Your next question is from Seamus Fernandez from Guggenheim. Your line is open.
Great. Thanks, guys. So just a couple of questions. First, on the upper limb spasticity opportunity, can you just help us understand the dose that you're most likely to select going forward, and where you have the highest conviction? It sounds like it's more the size of the study, but certainly the 500 being statistically significant while the others were not. That could be variability, or it could just be the effect size. So just love to get a little bit more color on how we should be thinking about the dose going forward. And the magnitude of effect, obviously 6 months, very positive, especially in this disease setting. And then the second question, Mark, just wanted, you've spoken about the HintMD and the contribution that HintMD can actually make to the overall organization. Just hoping that you could help us understand a little bit how this program and this effort is going to advance through the balance of the year. Obviously the other capabilities start to come online. Just hoping you could walk us through some of those incremental capabilities that would be coming online and what you feel they do for the overall aesthetic organization. Thanks.
Thanks, Seamus. So the first one, as it relates to dose, clearly, we ran this largely to inform our dosing strategies. We would move forward into a phase 3 program. The other nice thing is, this is a market that's fairly well characterized. There's competitor products that are in the market. There's extensive literature to look at, and we obviously benefit from the historical clinical trial programs that we have. So as you noted, the 500 unit dose did show statistical significance. We think that, along with the other information that we have from the trial, will provide us, sort of with the necessary background that we need to advance into a good end of phase 2 meeting with the agency. And again, I think over time too, we've got a much better appreciation for kind of core active neurotoxin in our product versus others and how those relate. As you mentioned, we did reduce the size of the study for all the reasons that Roman mentioned. Certainly patient recruitment was challenged, follow-up was challenging, but we felt that by truncating the study that we would still have adequate information to inform the next step. So I think it's more to come. We want to have that end of phase 2 meeting before solidifying a dose, but as we highlighted, certainly the 500 unit dose was the one that showed statistical significance in one of the co-primary endpoints. In terms of the HintMD contribution, let me just kind of maybe reframe it again. When we got into this, we talked about this payment platform. It's having the ability to participate in the overall credit card margin that's generated on every transaction, and that margin is kind of 2.4% to the low 4% on any transaction where there's a credit card